Medical professionals here in Trinidad and Tobago have confirmed there are no reports of severe side effects in children who have taken the Pfizer vaccine. Confirmation came during the Ministry of Health's COVID-19 press conference, which was held on Saturday. Kimberly De Souza tells us more.
There have been no real or significant side effects of the Pfizer vaccines in children. According to Regional Coordinator of Emergency Medicine at the North Central Regional Health Authority, Dr. Joanne Paul, most of the side effects have been anxiety-related.
So children, especially in that age group, might be so anxious that they might have chest pain. And it's just a matter of having some stomach irritation. They might have vasovagal episodes where they feel a bit faint. But once you resolve the anxiety and they're reassured, their symptoms go away.
Speaking during Saturday's COVID-19 health update, Dr. Paul also confirmed there have been no cases of pericarditis or myocarditis in children. Symptoms of these include chest pains and shortness of breath. But when questioned about a 17-year-old patient who recently took the first dose of the Pfizer vaccine and exhibited symptoms of anaphylactic shock soon after, Dr. Paul explained the symptoms of an anxiety attack may appear similar to an allergic reaction.
You may feel that part of the anxiety attack is when you feel that, I can't breathe. It's almost like hyperventilating. When the patient was assessed, what we found is that there was, as per lots of other cases, a lot of anxiety-related symptomatology.
Dr. Paul added that since the Delta virus is easily transmissible and has been observed to attack the younger population in several countries, parents should ensure their children are vaccinated.
So our mainstay right now is not just about vaccination, it's about vaccination in children for herd immunity, for going back to schools, and for their general protection with regards to our Delta variant.
Dr. Paul said vaccination is a second layer of protection, which includes safeguarding children's immune system and their mental health. Kimberly De Souza, TTT News.
Chief Medical Officer Dr. Roshan Parasram is urging parents to get their children vaccinated against the COVID-19 virus. The call comes after 11 children were reported to have died from the virus in Jamaica. 3 of them were children below the age of 10, while the other 8 were said to be children above 10 years old. Speaking during Saturday's COVID-19 health update, Dr. Parasram says children have recorded a better immune response to the vaccines than adults.
With a 2-dose regime, you're seeing just under 100% protection from severe disease and death with Pfizer. So it's almost 100%. Some of the literature actually says 100%. But I think there's always a reason to go a little bit less. So the response for Pfizer in children is extremely good. And it's another reason why really and truly for your children and the protection of your kids, you need to have that vaccine as soon as you can.
While booster shots for the Pfizer vaccines have not been approved by the World Health Organization, some jurisdictions have begun administering the third shots to their vulnerable groups who are more prone to COVID-19 complications.
And that subset of the population is where we're looking at possibly doing boosters at some point down the line. But again, the approval hasn't been given as yet. And we continue to look at the data coming back at us in terms of the way the immune system responds.
Dr. Parasram says the ministry will continue to monitor data before making a final decision. 8 more lives have been claimed by COVID-19 here in Trinidad and Tobago. According to the latest update from the Ministry of Health, among the fatalities are 2 men and 6 women. 257 people have also tested positive for COVID-19. The number of cases reported reflects samples taken during the period September 14th and September 17th. To date, 449,904 people are now fully vaccinated against COVID-19.